Smooth 98.1, love music, love life. This is Lagos Talks. Yes, Lagos and beyond. We're talking. And today the conversation is all about eye health. We have a special guest joining us this morning, but I'll let you know how you can be a part of the conversation because, yes, would love to hear from you. If you've got thoughts or question or comments, you can send them through to us via WhatsApp. The number is 0809 440 981. You can also tweet at Smooth981. And we're also streaming live on our YouTube channel. So you can catch that live stream up on YouTube. Our channel is Smooth981. And don't forget to subscribe. Today is the 12th day of March. And this week, from March 10th up until the 16th of March, is World Glaucoma Week. Now, glaucoma is the leading cause of preventable blindness and distinct challenges may be present all across. Now, the goal of this show today, of course, is to enlighten everyone, to encourage people to get the right checks, to detect eye disease and glaucoma as early as possible. Now, the theme for this year's World Glaucoma Week is Uniting for a Glaucoma-Free World. Our special guest this morning is Dr. Ayika Emenike. She is an ophthalmologist. She's got a master's in public health with a major in occupational and environmental health. Good morning, Dr. Ayika, and welcome to Lagos Talks.
Good morning. Thank you for having me. Thank you for the opportunity.
Thank you, thank you, thank you. So I'm going to start off with a little backstory. About 2 weeks ago, I remember talking about this on my show. I was out with a few people. We had a meeting, and there were easily about 5 or 6 of us. And while that meeting was ongoing, I realized that everyone had glasses on, prescription glasses, everyone. And I spoke about it on the show. I said, I thought about it and I found it a bit strange that of everyone in that meeting, not one was spared. Everyone needed extra help with regards to this. Like, so Dr. Ayika, what is it that has changed that requires more and more people to use prescription glasses? Because when you think about it, some of us have had older parents or grandparents, and they didn't seem to have any issues with their sight. They didn't need medication or prescription frames. So I wonder, is there something that has changed in recent times?
It's brilliant you have to bring it up because there's actually like an increasing epidemic. In fact, let me put it this way: by 2050, half the world may have to be on glasses. That's how bad the projection is. Yes, yes. So to give it to give a perspective to what you said, what has really changed is I'm going to try to streamline a lot of this to blend with general eye health and glaucoma. And by and large, at the end of the show, if my main aim is to get people of all ages to just have a screening done, right? So in terms with the specific question you asked about glasses, there's a progressive shift. Now, you see, we're going from outdoor to indoor work. We're going from outdoor work to near work, screen time, digital screens, and et cetera, et cetera. So this has come to stay. And I think a lot of it, I can trace it back to the COVID era, because there was a big shift towards everything digitalized and, like virtual this, virtual that. And what a lot of people seem to forget is that you're talking about cumulative time. So you're at work, you're on the laptop, you're with your phone, you're on the screen, you're reading, you're doing near work. So all this really would increase what we call, you call it short-sightedness. There's myopia, that's what we call it. There's an increasing trend towards that. And it's not just you. We're having children as young as 1 year, 2 years coming down with the need for glasses and stuff. So it's really going to, I'm sorry to say, but it's not really going anywhere. It seems to be more progressive at this time. All right.
Oh, wow.
But and I guess this is going to bring me into the next thing I want to say. Each time we talk about glaucoma over the years, people just think of my grandma or my mom, my older mom, my younger mom. But today I want us to really look at eye health with respect to associations and risk factors of glaucoma. We're going to start from cradle to crown. What I mean from cradle to crown, because people seem to forget that we have things like congenital glaucomas. We have things like secondary causes that even start from within the uterus, what you call the womb, that can predispose a child to this along the line. So if you were to look at moms, okay, just off the top, there's a particular one that troubles me because I'm seeing an increasing trend towards that. By and large, glaucoma, you have the primary cause, and then you have the primary glaucomas and the secondaries. Just to make it simple, the primaries, there's no non-identifiable cause, but for the secondaries, you can identify the underlying pathology, right? Now, if you were to take a pregnant woman, just for instance, there's something that they don't know about. It's called toxoplasmosis, like a uveitis, right? Which a child can get in utero. It can be transmitted from. And where do you get this from? Poorly cooked meats, sometimes. Raw meat, yes. And why do I say it? Maybe it's because of an encounter I had recently. I see the way people handle meats these days. They just handle it anyhow. And I see some supermarkets that have bakery and they have cats running round and around without anybody taking care of them. Cats actually the definitive host for this disease. And one of the things it does, the disease itself, the sequelae, like the side effects one gets from this disease can lead to secondary glaucomas. And even some of the things we used to treat it like steroids can predispose the patient to secondary glaucomas as well. So if we were really to discuss eye health and glaucoma, we're going to really have to start from even the baby. Wow. So that's why from across board, so still on the baby issue. So when we say a child is born, please get an ophthalmic evaluation. It's not because people want you to just keep coming in and out of clinics, but you owe it to the baby to actually have their eyes screened. I was speaking with a child one time. I showed a colleague, no, not a colleague, a friend, a picture of a baby with what they call blue eyes. But they're like, oh, the baby is so cute. I said, no, this child has congenital glaucoma. Those are no blue eyes. That's a problem. So that's when, oh, they're not blue eyes. I said, no, they're not blue eyes. It's problematic. Please rush and see the pediatric ophthalmologist right now. So that's one part of it. So not just older people need their eyes checked. So if you give birth to a baby, when you're comfortable going to the hospital, go back again, have the eyes checked. It saves you a lot of stuff. Within the infantile period, that's also where you have things like squints, deviations. That's where you can detect things like cataracts. And some of the side effects from treating these things can also predispose a child to secondary glaucoma. So they just need to get the eyes checked, even as little as they may be. I know a lot of mothers may not want to hear this, but
because speaking about children, there is a popular belief that if a child has eye conditions, I don't know if it's cultural, perhaps it's not a great idea to get them glasses because their eyes will automatically correct themselves. Have you heard this, Dr. Ayika? Because I have.
Okay, yes, I have. And it's a twofold approach. There's a little bit of truth in it because of what we call the normal process of as the child is growing, the normal tendency, all things being equal, is to have emmetropization, whereby at some point things should stabilize. But like you rightly said, things have changed. You see a 1-year-old, 3 gadgets in front of them, trying to fathom for whatever reason it's in front of them, maybe just so that the mom can sleep properly. The near walk, the school, the amount of homework they give the children these days is a bit of alarming. So they don't even have time to go outside, right? So what these things, the shift in the environmental trends that we have now is actually impacting negatively on their ability to grow normally over the years as they used to. So what you have now, a child that should be outdoor playing, getting their cells stimulated with the light so that their dopamine can help, stem the risk of myopia. You see, they are deprived of that. And when they're deprived of that, that shift to normalcy may never really occur, the emmetropization. So what you have is you're still going to go back either having myopia, and unfortunately, if this begins to happen at an earlier age, it gives them a more increased risk of having the worst type of myopia, which is pathological form, where you don't just have things like, just the refractive error. You can actually even get down to retinal detachment. So for that reason, I suggest to mothers, don't be afraid of glasses, right? If you need to use it, just use it. First of all, even get the eyes checked, all right? Don't be like an ostrich, you're wishing it away. Okay, so that's how I would answer that with that regard. And
Okay.
if I were to come from a public health point of view, I would also encourage them, if you're like in a PTA meeting in your schools, encourage outdoor time for children. Because I see some schools, they're having the assembly indoors, the children having to go out to get some vitamin D. It's wrong. Because one of the things that a lot of research is going into now, in fact, they've been doing it in some Asian countries, where there's a mandatory order that children must spend at least 40 minutes to 80 minutes outdoors just to, stimulate the dopamine, get the vitamin D, just everything possible to try to reduce their switching over to,
Mm.
myopic, refractive errors.
All
So,
right.
but here we are. We need to practice that a little bit more.
All right. So, you did talk about vitamin D, and I'm
Mm.
curious about this. Are there specific nutrients? Because every now and then you hear someone says, "Oh, you should take this. It's good for your eyes." Maybe it's yeast or something. You hear a lot of these, and it's hard to differentiate between the old midwife's tales and what is actually the reality. So, are there truly some foods or nutrients that specifically could help improve eye health overall?
Okay, so that's a beautiful question. And I'll answer it like these. I'll go from the synthetic ones, the ones that we get off the shelf. They are called supplements for a reason, to supplement what you're not getting enough of, right? So, for instance, if you were to look at the eye holistically, especially if you're taking it back to optic neuropathies, of which glaucoma is one of them, there's what we call nutritional optic neuropathy, whereby you're lacking some certain nutrients like the vitamin B12, right? And these deficiencies of these vitamins, it's not good for the nerves at the back of your eye, right? So in this case, there is a deficit. So these supplements may be adequate for you. And I use the word maybe because I'm careful. There's so much out there that some of them, as far as research has shown, end up being placebos. So if you can get these things from the natural sources, that's
Mm.
nice. Okay, and it goes back to what we're talking about age-wise. The shift, while we're having all these things among even younger people, the shift also, just check their diet as well. Like for the younger ones, some of them really don't have these vitamins in their everyday food. If you were to think about it, the fruits, the veggies, even the exposure to sunshine, I mean, the free vitamin D is out there. So if you were to talk about supplementing what is deficient, that's fine. But if you're just going to go get tablets just to pop, I'll suggest you start with the natural ones, as much as you can in that regard. So yes, there is some truth to it because this deficiency can actually lead to nutritional optic neuropathies, which impacts negatively in the long run, especially if they get older and they start to have, the age-related forms of the disease. So I hope that kind of answers the question.
Yes, indeed it does. We're speaking with Dr. Ayika Emenike. We're talking about eye health and glaucoma. This is Glaucoma Week, and the aim of the show is to basically create as much awareness of the overall benefits of eye health. Do stay with us. The conversation continues on the other side. Okay, Doc, we'll be back on in 30 seconds.
All right.
I'll send you a picture. Oh, okay, thank you. Mhm. Hi, Doc. We're coming back.
All right. Okay.
You're listening to Lagos Talks on Smooth 98.1. It's Zibby here, and our guest this morning is Dr. Ayika Emenike. We're talking about eye health and glaucoma. As always, you know, Lagos Talks is interactive. I can see some of your messages coming through. Please keep them coming. The WhatsApp number is 0809 440 981. You can also tweet at Smooth981 or even give us a ring as well. Yes, the phone number to call is 01 4489981. Doctor, I'm curious about this. Sometimes people say, oh, my eyes are itchy, it's an irritation, or I've got tears coming down my eyes. Maybe it's stress. Are there any warning signs that people absolutely should be looking out for that is an indicator of perhaps a serious eye condition and not just dust in the eye or an allergy?
All right. So if we were to tie that with, that's a very good question, by the way. So first, one thing I've come to realize is over the years is it appears that the most sinister eye conditions are, they may not even give you pain. You know, they don't give you the typical things that bring people to the clinic, you know, the pain, the redness kind. For instance, what we're talking about, glaucoma, if you were to look at just the primary open angle type, not you won't get any symptoms. You may just have occasional tearing, I just tear, or I just feel heaviness from the pressure, blurry vision, you know, those non-specific symptoms, and then they ride it over. So a lot of times we actually pick up glaucoma cases or cases, retinal cases, more blinding conditions, when the patient's coming for something, let's say they're having red eyes and they're worried they got Apollo from school, and then you're telling the patient, see, the redness is the least of your problems, sir. There is something worse at the back of the eye. And they're looking at you like you're a big scam. What do you mean? You understand? So it's the way I'll answer that question is, if you have such things like discomfort, and I'm not saying that they're not simple things. Of course, simple things are more common. Like the tearing can just be from dry eyes, right? The redness can just be from even the dry eyes and a little bit of irritation or allergies. But why don't you use that opportunity to go have your eyes checked, as opposed to going to the pharmacies to get over-the-counter medications? And for such things, you know, if you happen to enter, like we say in Lagos, one chance, you're there using steroids or things that would, you know, negatively impact him, and you know how you go for something simple and you come back with a problem. So why don't you just use that opportunity to get that eyes checked? Like I tell people, it's interesting, you spend this amount of money for things like clothing. Why don't you just save up and give your eyes a treat? Does that make sense? Yes. So
Absolutely.
yes. So to answer that question, the more sinister evil conditions may not even come with all those pain things. Okay. So having said that, there are just so many other ways. The thing is, the body is wired beautifully. If it doesn't sit right, just go have it tested. Don't sit on it. We know go Greek kind of sitting on it.
Indeed. Let's look at a message coming through on WhatsApp. This is from Edgar. Edgar says, let's not forget the cell phone culture we foist on our young children. I think that's a contributing factor to sight deterioration these days. Okay. Um, Dr. Ayika, can you explain the link between certain medical conditions, diabetes, hypertension, and eye health?
Okay. So I'm trying to see how to put it in a simple way so I don't bore the viewers. Right. So
Okay.
when we talk about, okay, you mentioned eye health, but for some reason I would always try to link it back to glaucoma just to keep it a feel. So something like hypertension, diabetes, right? These impact the blood vessels. And don't forget that the eye is not detached from the body. This, if anything, the vessels that go to the eye, they are micro vessels, if we were to use that. Now, these conditions like the hypertension, the diabetes, they impact on the micro vessels, right?
Mm.
For instance, if you look at hypertension, at the two extremes, severe increase in the blood pressure or very low blood pressures, these two actually would impact negatively on your eye health. What do I mean? When it's so high, what you have is like a peripheral resistance in the pipe. So just imagine you have a hose running somewhere. If you squeeze the hose, not much water is going to flow through it, right? So it's like you're
Mm.
restricting the flow. So that
Right.
restriction to the flow that should be getting to the eyes is underperfused. In the same way, the hypotension, there's not enough pressure pushing it there. And one of the theories to what may be causing glaucoma is the vascular theory, where the hypoperfusion would impact negatively on this optic nerve head and, predispose one to the glaucoma that we're talking about, right?
Mm.
Now, that's just one part. Now, for these, still on hypertension, when it's so severe, sometimes you have, imagine those little vessels with that much pressure, they're actually going to rupture and someone starts to bleed at the back of the eye. The same, a different mechanism now for the diabetes, the glucose content within the vessels. There's a certain amount that shouldn't be there naturally. So when it's in that quantity, it becomes toxic to the walls, sort of erodes it, and then you start to have bleeding, both in the back and in the front. And bear in mind that a lot of these people tend to self-treat. So I often hear people saying, "Oh, I went to the doctor, I saw him once. All I'm doing is I'm just repeating my tablets." No, you don't just do that. I hear people say, "Okay, I take my pill when the sugar is up. When the sugar is normal, I stop taking." Please don't self-treat, because a lot of times you run into trouble with the oscillation of your, up, down versus stability in your treatment. The word is stability. If you have less fluctuations, you're less likely to run into trouble. And if you work closely with the eye health professional, we can detect some of these things before they reach the burst. In fact, a lot of times the ophthalmologists are the ones that are able to diagnose hypertension in a patient or diabetes. They may not even know they have that till they come around. So
Mm.
there is truly a connection. And so that I won't forget, I just want to throw this in case you're on antihypertensive. One of our recommendations, especially for people at risk for glaucoma, is don't take antihypertensive in the night, because it dips the pressure, it makes it come down, and that hypo kind of environment that you're having reduces the perfusion to the vessel. So we encourage them, except there's a reason for them. We work with the cardiologist, but we prefer that they don't take it when they're going to bed.
Okay, thank you for that, Dr. Ayika. Now, with regards to glaucoma, how often should people get a screening or get checked, particularly maybe if there is a family history in some way?
All right. So to answer that, first of all, I just want to dispel some myths. Yes, family history is one of those they are high on the line for risk factors for glaucoma. But sometimes when I hear people saying it's not running in my family, there's no need for me to check. Please remember that the sporadic causes, so you may actually be the prodrome for that disease. So don't just say because it's not in my family, I'm not going to check. So this got cuts across. But back to the question, if there's a risk for it, especially because there's a family history, when you go in and have your eyes tested the first time, based on your risk profiling, that's where you'd actually get a feedback as to how often you come. Because you may come in and everything is fine. The doctor can give you, okay, come yearly, let's do this yearly. But if you come in and you fall under the category of what we say glaucoma suspect, or you have suspicious risk based on whether it's a structural or functional test, one or two that you have failed, we may actually give you a closer appointment, let's say 3 monthly, 6 monthly, or even monthly, as the case may be. So it's really like risk profiling patients. It's individualized. So the first step is you come in, we assess you, see where you are, and then we place you on high risk, low risk, or just let me see in 5 years' time kind of a thing. And this really goes for everybody that we're going to be screening. It's individualized.
All right. We're speaking with Dr. Ayika Emenike, and she's an ophthalmologist, got her master's in public health, major occupational and environmental health. And we're talking about overall eye health and glaucoma. This week is Glaucoma Week, and the idea is to bring awareness to this condition. So if you've got a question, you have a comment, this is the time to send it through. The WhatsApp number is 0809 440 981. You can also tweet at smooth981. We're streaming live on our YouTube channel, so you can catch that live stream right now. Post a comment underneath as well. We're looking out for those. It's smooth981, that's the channel. And phone line's open, so you can give us a ring. 014489 Don't forget to subscribe on YouTube so you can watch this interview at a later time, of course, if you absolutely need to. Speaking about glaucoma, what are the possible treatment options, doctor? Is it something that you get a treatment that lasts for a lifetime, or is it something that has to be ongoing when it comes to this?
So at this point in time, just based on the definition itself that is multifactorial and that we are not, there are so many, a plethora of theories. The one that we've really been able to lay hands on, what we can treat in, when I say that in parentheses, is really try to manage the eye pressures, right? Now, in terms of treatment, there are different options. There's a medical, there's a surgical. Like you rightly said, running through a lifetime. Now, again, understand at the back of the head, every person, the treatment is individualized. It's tailored for you because somebody may come in, glaucoma is all you have. Someone comes in, you have glaucoma, and you have other pre-existing conditions, like you mentioned rightly, diabetes, comorbidities, right? So in that sense, we profile you again, find out, and it's not a one visit treatment, really. If we were to give it an umbrella term, for the younger ones with the disease, to improve adherence and because of the life, the life expectancy, the long life expectancy, surgery is really there on tops for them. All right. Now that you've done surgery, being first line doesn't mean that they don't still have to use drops. About 70% of the time, they still need to be placed on drops, right? That's one. Now, for the older ones, let's say, they are much older, 80, 85, 90, and that's why I'm discovering it. Sometimes at that time, if it's really advanced, we may look for more conservative ways to manage them because a lot of time they don't even want to hear about surgery at that time. Okay, so that's one off to say it. But by and large, the essence of this whole exercise is this: if you can get it on time, there are even less traumatic ways to approach this. We have the laser the SLT. We have the laser parts. We have even more micro-invasive surgeries that are not like all out, cut open and all that. So again, the point is try get the eyes checked early. When we find it early, we have more room to explore less, traumatic means of managing. And the word is managing because it's not a treatment whereby you take anti-malarial and the malaria goes. It's really decrease the progression of damage to the eyes. So that's kind of what it is in a nutshell.
All right, thank you for that, Dr. Ayika. We're speaking to Dr. Ayika Emenike, and it's about World Glaucoma Week. Do stay with us. The conversation continues on the other side. Okay, Doc, we'll wrap up on the other side once we come back.
All right.
Thank you.
All right. I do hope, I do hope you're getting like information because I didn't know whether I wanted to do Q&A or to receive a lecture. So I'm like, anyone goes.
No, this is perfect. You're making it very interactive. And
Okay.
that's what the people need when it's
Yeah,
conversational and they can relate. So this is
exactly. So I don't want to use big English and all that.
oh yes, please. Okay.
Yeah.
You're listening to Lagos Talks on Smooth 98.1. It's World Glaucoma Week, and we're speaking with Dr. Ayika Emenike. We're talking about glaucoma and overall eye health. Now, the idea of World Glaucoma Week this year, the theme actually is Uniting for a Glaucoma-Free World. It's basically focused on bringing communities together to fight against this eye illness. Now, as always, it's interactive. So if you've got a question or you've got a comment, the expert is in 0809 444 981. That is the number to send your WhatsApp messages to. You can also tweet at smooth981. And you can post a comment underneath our live stream on our YouTube channel is smooth981, or just give me a ring. The phone number is 01 4489 981. Now, Dr. Ayika, you spoke about perhaps we've moved to a more indoor kind of living. People are not spending as much time as they do downstairs. Is there also a risk of people spending perhaps a little too much time out in the sun that could have an effect on eye health?
Okay, Zibby, I'm going to take you. We're going to be the next doctor on our team. That's a very good question too. We're taking you up. Yes. All right, definitely. So, like when we say outdoor exposure, I don't expect people to take out a sunbathing suit and stand in the middle of the sun at 12 noon, because of course, if you are in the wrong kind of sun for a long time with all that exposure, one can actually come down with what we call pterygium. I don't know if you've seen it in people's eye. It's best seen. It's like a little white kind of triangular thing with its apex popping towards the black part of the eye.
Oh,
That's
wow.
one of the things one can get, right? And then, of course, by the time the sun is blasting mid noon and all that, you also want to protect your people with the UV, with the photochromatic lenses we usually would give them, just to delay progression of conditions like cataract and degenerations at the back of the eye. Okay, such
Mm.
things. So it's more or less like the good old morning sun when we got. Well, I mean, remember in primary school, you go out, the day is bright, you're marching, and then you're receiving the
Oh,
good old. Yes, not to go out and stand under the sun for a long, long time. No, not that. Yes.
okay. So you did
Um,
speak of cataract. Okay, sorry. Please go ahead.
no, 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 that's fine.
Oh, all right. You just spoke about cataracts, and I want us to talk a little bit about that.
Okay. Right. Okay. So inside the eye, I mean, there's a picture behind me, but I think it might be too
I can
small.
actually see it. My glasses are good.
Yeah. Unfortunately, I don't know if you can zoom into this. Right. Do you see that
Yes,
better?
yes,
Brilliant.
yes.
Okay. So I'm just going to grab a pen because pictures speak 1,000 words. So that's the
Absolutely. Back
eyeball.
to school with Dr. Ayika.
Awesome. So that's the eyeball, right? And then
Yes,
there's this transparent thing you see here, this round spherical thing here.
yes,
So
yes.
that's what we call the human crystalline lens, right?
Mm.
Now, ideally, it should be clear so that you can have light transmitting all the way to the back, right?
Okay,
So that this
yes.
is where what you see is processed. These are the wires that run from the eyeball, what we call the optic nerve, like
Mm.
about 1 million of them running to the brain, right? So these should be transparent in order to allow the light to go in. But what happens is this lens, sometimes it becomes, blurry, cloudy. And if you notice, the cloudiness can start from any side, the central side part. So whenever any part of it becomes cloudy, we refer to it as cataract. And that's why you hear sometimes we say visually insignificant or visually significant. So depending on the density of the cloudiness, and not just the density, but how much impact does this cloudiness, how much impact, to your work, everyday work is it having? So whenever that begins to impact your visual tasks, then we go out, take it out, and then put an artificial lens inside there. So it's replaceable, more or
Okay,
less. As long
okay.
all things being equal, if the support is good there. Yeah.
Now, this cataract, it seems to be something that we hear a lot about, particularly in older people. Is this an illness or a condition that is restricted to older people, or can it happen to anyone at any point?
So in our environment, so one the commonest cause is age related, right? Is age
Okay.
related, the natural progression. So it's just the same way things are getting all saggy, baggy, and all that with age.
Mm.
That's kind of the way it does. Now, but you have secondary causes. In fact, if you track all the way back, you actually have congenital cataracts. People are born with it due to, a whole variety of things, right? Now, you also have the secondary causes. So it's not restricted to the older age group because, for instance, if a child gets poked in the eye at school with a pen, trauma, something hits in the eye, especially you have, the cane hitting the eye, that trauma can actually lead to cataract in the eye, okay? And remember we said something about uveitis, inflammation. So inflammation, chronic inflammation, prolonged inflammation, or significant enough inflammation can actually lead to cataract. So it's not just for the old patients alone, for the old and, for the elderly alone. So any age group can be impacted. But when we talk about the age one, it's usually as they grow older. That's why it seems to be as if it's only in the older age bracket. Yeah.
All right, Dr. Ayika, I know you have a busy morning, and I'm so thrilled that you were able to make time for us. I have to ask this, though. Are there some tips that you can give to regular folk like me and everyone else who's listening that can just basically help us maintain overall good eye health, whether we already use prescription frames or not?
All right. In order to capture like you said, in order to capture everybody, no one gets left behind, right? If we're to go right from the baby inside the womb, so your responsibility as a pregnant woman, be careful what you take in, like we said earlier, right? So you're not as a pregnant lady, I don't expect you to be carrying cats and taking out the cat litter boxes, because these, like we mentioned earlier, some of the risk factors, right? Watch what you eat too. Be careful with all those things you buy from the market. At least wash them so that babies, I don't have to say, you don't be around, toxins like smoking around you. Though these are anecdotal risk factors, but anything in that regard can put your baby in a jeopardy. Try to avoid it. Now, when the baby is out, you do the needful. When you're discharged, don't just go. Within the first 6 months of the baby being born, try and get an ophthalmic review of that child's eye, because if anything congenital is going to pop up, it should show up before then. So it's not you wait till there's nothing we can do about it, then you start coming, all right? Now, for the infants or preschoolers, I'll call it, try and get these children engaged outdoors. I know it can be hard for mothers because, we're not having as much privilege of having, domestic aids. So, but don't just shove them in front of the TV or shove phones, screens in front of them. Try and engage them outdoor. Even if you don't have space in your house, there's a lot of estates that have parks. You can, call your friend and go out there and play. Okay, so for these ones, remember that if you don't do this, they're going to become a liability in your old age. You don't want that. And things are not cheap anymore, all right? Now, if you get tested and they say glasses or they say this, you go ahead and do that, because a lot of times you see somebody that tried to prevent the child from getting it. Later on in life, the child gets amblyopia. There's nothing you're going to do about the amblyopia. But if you had gone earlier and done what you were told to do, that would have helped at that one. So that's for the age group, right? And then for, if you want to talk about the young adults, juvenile, think about it this way. You're going to get older, you're going to get into the workforce. So kind of save your eyes, all that stress, till then it becomes inevitable for you to use the screen, and you're using it productively, not as opposed to just, spending whiling away time there. And still on the juvenile, like you rightly said, what they eat matters at this point. What they eat matters. So don't say you just exercise everything out. Find healthier options. Have fruit baskets on your table. Encourage veggies. All right. See what you pack in their meals. Not every time it's fizzy stuff, right? And I know some schools that do that as a program in terms of they have fruit days and all that. That's nice, so that you can sensitize these children on it. And then still on the for the young adults. I know that there is a lot going around about the use of recreational drugs, or what you call street drugs. These are really dangerous, because optic neuropathy, which is like pathologist optic nerve, one of the things we have is toxic optic neuropathy. Things like alcohol, things like some of the substances they use, they've been implicated in this. So what you have is what you did during secondary school is catching up to you at the time you're 48, 45. Because sometimes I get patients, they're 45. And I'm looking, okay, you have optic neuropathy. Nothing happened. Where did I get that from? But by the time we trace back your history, oh, I was just using it then. Everybody was using it, so we just used it. Yes, everybody may get into using it, but you may just be the scapegoat that comes down with the irreversible processes in your later life. So, just do the right thing when you're young so that these things don't catch up with you later on in life, right? And then the well checks. I know a lot of offices now do yearly annual checks. Enroll yourself in that. I mean, it's free, it's nice, it's cheap, and don't be afraid of the diagnosis. That's just get it tested. At the worst, you get yourself some prayer points from whatever they've told you. Does that make sense? Right. And and in terms of food, we mentioned that one of the things I chip in because I get asked that a lot of times. They talk about Gary. So the thing we actually mention when it comes to Gary is with respect to the cyanide content. And the cyanide content is like more or less directly proportional to when you don't ferment it properly. So that's the way I'll answer it. And you can, maybe it's because I'm a woman, but you can smell Gary and know the ones that are poorly fermented. They are so raw, you can smell the rawness as opposed to the well fermented ones. So I just decided to chip in there because we're in Nigeria and we know we like to soak. I see a lot of these beautiful adverts with Gary, groundnut, and milk swelling in the
Yes.
plate. You can't even understand that this is, I mean, it looks so good. Right. So I'll put it there. And then, of course, for the, as progressively get older, that one, it becomes more or less compulsory for you to go have that reviewed. So I think in a nutshell, that's how we would put it. And, you know, the OTC, I can't keep, I won't stop talking about it. Don't just use any eye drops because you want to, right? And again, to chip this in, because we've had quite a number of cases, some of our beauty products, because of poor regulation around us, some of the things they bring into the country actually carry chemicals that have been banned in other nations. All right. And if you remember that your skin has, one of the, if not the highest area of absorption, what you put on your skin eventually gets into that eye. So we've seen skin lightening creams. They have this, appalling levels of steroids, mercury, lead. All these are going to end up in the back of the eye, and it makes your management even worse. Like your recovery time after cataract will not be the same as somebody that didn't get exposed to this. So that's just a brief summary. I'm just trying to keep things simple. But by the time you walk into the clinics, I'm sure you get more.
Wow. This has been very enlightening, Dr. Ayika. It's always a pleasure speaking to you about the eyes and their health. So thank you so much for being on the show this morning.
Thank you for having me.
Thank you. That was our special guest, Dr. Ayika Emenike. We're talking about eye health and glaucoma with regards to World Glaucoma Week. She's an ophthalmologist. She's got a master's in public health, major in occupational and environmental health. And I have to say, an amazing human being as well. Thank you, Dr. Ayika, for being with us
Thank
this
you so
morning.
much.
And just in case you didn't get the entire conversation, it's not a problem. We've streamed it live, so you can catch it at any point on our YouTube channel. And there's also a chart that Dr. Ayika was kind enough to show with her pen, just pointing out little things. So even if you're listening right now, you can actually go on YouTube and watch that video and just look at the information that she's giving that came from that chart as well. And that is it for Lagos Talks this morning. Thank you